Did you know that by age 60, more than half of men will experience an enlarged prostate? And by 85, that number jumps to 90%. But here's what most men don't realize. Many everyday habits are silently contributing to this problem right now. Hey everyone, welcome back to the channel. Today we're talking about something that affects millions of men but rarely gets discussed openly. Benign prostatic hyperplasia, or BPH, commonly known as an enlarged prostate. More importantly, we're covering 9 surprising habits that could be making your prostate bigger without you even knowing it. If you're over 40, or you care about someone who is, stick around because this information could make a real difference. And don't forget to hit that subscribe button and turn on notifications so you never miss our health content. Disclaimer. Quick disclaimer. This video is for educational purposes only and doesn't replace professional medical advice. Always consult with your healthcare provider about your specific situation. Habit number 1. Sitting for extended periods. Let's start with something most of us do every single day. Sitting. Whether you're working at a desk, driving, or binge-watching your favorite show, prolonged sitting puts constant pressure on your prostate. Why it matters? Your prostate sits right below your bladder, and when you sit for hours, especially on hard surfaces, you're putting direct pressure on this walnut-sized gland. This pressure can restrict blood flow, cause inflammation, and contribute to prostate enlargement over time. The mechanism. Think of it like this. When you sit, your pelvic floor muscles and the prostate are compressed. Poor circulation means less oxygen and nutrients reaching the prostate tissue, which can trigger inflammatory responses. Add in the fact that sitting reduces overall physical activity, and you've got a perfect storm for prostate problems. What to do? The solution? Take standing breaks every 30 to 45 minutes. Consider a standing desk if you work at a computer. When you do sit, use a cushion designed to relieve pressure on the perineum. And most importantly, stay active throughout your day. Habit number 2. Excessive red meat and dairy consumption. Number 2 might surprise you. Eating too much red meat and high-fat dairy products. The connection. Research has shown a correlation between diets too high in red meat and full-fat dairy and increased prostate problems. These foods contain saturated fats and may contain hormones that can influence prostate growth. What the science says. Studies suggest that men who consume large amounts of red meat and high-fat dairy have higher rates of BPH. The saturated fat in these foods can increase inflammation throughout the body, including in the prostate. Additionally, some dairy products contain hormones that may affect your body's hormonal balance. Better choices. I'm not saying you have to go completely vegetarian, but consider this. Try incorporating more fish, especially fatty fish like salmon, which contains omega-3 fatty acids that fight inflammation. Choose lean proteins like chicken, turkey, and plant-based proteins. If you eat dairy, opt for low-fat versions. Fill your plate with colorful vegetables and fruits, which bring us to our next point. Habit number 3. Not eating enough vegetables and fruits. Habit number 3 is the flip side, not eating enough vegetables and fruits. Why produce matters? Vegetables and fruits are packed with antioxidants, vitamins, and phytonutrients that help protect your prostate. When you skimp on produce, you're missing out on natural compounds that fight inflammation and support prostate health. Key nutrients. Let's talk specifics. Tomatoes contain lycopene, a powerful antioxidant linked to better prostate health. Cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts contain compounds that may help regulate hormones. Berries are loaded with antioxidants. And don't forget about pumpkin seeds and nuts, which provide zinc, an essential mineral for prostate function. The goal. Aim for at least 5 servings of vegetables and fruits daily. Think of it as eating a rainbow. The more colorful your plate, the more diverse nutrients you're getting. Make vegetables the star of your meals, not just a side dish. Habit number 4. Excessive alcohol consumption. Moving to habit number 4. Drinking too much alcohol. How alcohol affects the prostate. Alcohol is a bladder irritant, which means it can worsen urinary symptoms if you already have an enlarged prostate. But it goes deeper than that. Regular heavy drinking can cause hormonal changes, particularly affecting testosterone and estrogen levels, which play a role in prostate health. The inflammation factor. Alcohol also promotes inflammation throughout your body. Your liver processes alcohol, but when you drink excessively, it creates oxidative stress and inflammatory compounds that circulate through your bladder, eventually affecting your prostate. Finding balance. Moderation is key. If you drink, limit yourself to 1 or 2 drinks per day maximum. Pay attention to how alcohol affects your urinary symptoms. Many men notice they need to urinate more frequently after drinking. And remember, staying hydrated with water is always better than reaching for another beer. Habit number 5. Not exercising regularly. Number 5. Living a sedentary lifestyle without regular exercise. Exercise and prostate health. Multiple studies have shown that men who exercise regularly have lower rates of BPH and better prostate health overall. Physical activity helps in several ways. It reduces inflammation, helps maintain a healthy weight, improves circulation, and balances hormones. What counts as exercise? You don't need to become a marathon runner. Moderate exercise is incredibly effective. We're talking about 30 minutes of activity most days of the week. Walking, swimming, cycling, playing sports, or even gardening all count. The weight connection. Here's something important. Being overweight or obese significantly increases your risk of prostate enlargement. Excess body fat, especially around the midsection, produces inflammatory compounds and affects hormone levels. Exercise helps you maintain a healthy weight, which in turn protects your prostate. Bonus tip. Pelvic floor exercises, also known as Kegel exercises, can be particularly beneficial. These strengthen the muscles that support your bladder and help with urinary control. Yes, Kegels aren't just for women. Habit number 6. Chronic stress and poor sleep. Habit number 6. Chronic stress and not getting enough quality sleep. The stress-prostate connection. When you're chronically stressed, your body releases cortisol and other stress hormones continuously. This triggers inflammation throughout your body, including your prostate. Stress also causes muscle tension in the pelvic area, which can worsen prostate symptoms. Sleep matters. Poor sleep compounds the problem. Your body needs quality sleep to repair tissues, regulate hormones, and reduce inflammation. When you're sleep deprived, inflammation increases, and your immune system doesn't function optimally. The vicious cycle. Here's where it gets tricky. An enlarged prostate causes frequent nighttime urination, which disrupts sleep, which increases stress, which worsens prostate health. It becomes a frustrating cycle. Breaking the pattern. Practice stress management techniques like deep breathing, meditation, or yoga. Establish a consistent sleep schedule. Create a relaxing bedtime routine. Limit fluid intake in the evening to reduce nighttime bathroom trips. And consider talking to a healthcare provider about managing stress and sleep issues. Your prostate will thank you. Habit number 7. Ignoring urinary symptoms. Number 7 might be the most dangerous. Ignoring early warning signs. Common symptoms. We're talking about weak urine stream, difficulty starting urination, frequent urination especially at night, feeling like you can't completely empty your bladder, sudden urges to urinate, or dribbling after urination. Why ignoring symptoms is harmful. Many men think these symptoms are just a normal part of aging and ignore them. But here's the problem. When you delay seeking help, your prostate can continue to enlarge, making the condition worse. Left untreated, BPH can lead to urinary tract infections, bladder stones, kidney problems, or complete inability to urinate, which is a medical emergency. The psychological toll. Beyond the physical issues, ignoring symptoms affects your quality of life. Many men avoid social situations, can't sleep through the night, and experience anxiety about finding bathrooms. This doesn't have to be your reality. Take action. If you're experiencing any of these symptoms, schedule an appointment with your doctor or a urologist. Early intervention means more treatment options and better outcomes. There's no reason to suffer in silence. Habit number 8. Excessive caffeine intake. Habit number 8. Consuming too much caffeine. Caffeine as a bladder irritant. Coffee, tea, energy drinks, and sodas containing caffeine can irritate your bladder and worsen urinary symptoms associated with an enlarged prostate. Caffeine is a diuretic, meaning it increases urine production, which makes you need to urinate more frequently. The stimulation effect. Caffeine also stimulates the bladder muscle, which can trigger sudden urges to urinate. For men with BPH, this can be particularly problematic, especially when combined with an already narrowed urethra. Finding your threshold. Everyone's sensitivity to caffeine differs. Some men can handle a couple of cups of coffee without issues, while others notice symptoms with just 1 cup. Pay attention to how your body responds. Smart strategies. Try limiting caffeine intake to the morning hours to avoid nighttime symptoms. Consider switching to decaffeinated or half-caffeinated versions. Herbal teas can be a great alternative. And remember, it's not just coffee. Read labels on sodas, energy drinks, and even some medications, as they often contain caffeine. Habit number 9. Not staying properly hydrated. And finally, habit number 9. Not drinking enough water throughout the day. The hydration paradox. This might seem counterintuitive. You're thinking, wait, won't drinking more water make me urinate more? Here's the thing, when you don't drink enough water, your urine becomes concentrated and irritating to the bladder, which can worsen symptoms. Proper hydration benefits. Adequate hydration keeps your urinary system flushed, reduces the risk of urinary tract infections, prevents kidney stones, and actually helps regulate your urination patterns. Concentrated urine is more likely to irritate your bladder and prostate. The right approach. The key is timing and amount. Drink most of your water during the morning and afternoon. Sip steadily throughout the day rather than chugging large amounts at once. Reduce fluid intake 2 to 3 hours before bedtime to minimize nighttime bathroom trips. How much? Aim for about 8 glasses of water daily, but adjust based on your activity level, climate, and individual needs. Your urine should be pale yellow. If it's dark amber, you need more water. If it's completely clear all the time, you might be overdoing it. So let's quickly recap these 9 habits that can enlarge your prostate. Sitting for extended periods. Eating too much red meat and high-fat dairy. Not consuming enough vegetables and fruits. Excessive alcohol consumption. Not exercising regularly. Chronic stress and poor sleep. Ignoring urinary symptoms. Too much caffeine. Not staying properly hydrated. The good news? You have control over all of these factors. Small changes in your daily habits can make a significant difference in your prostate health. You don't need to overhaul your entire life overnight. Start with 1 or 2 changes and build from there. If you found this video helpful, give it a thumbs up and share it with someone who might benefit. What habit are you going to change first? Let me know in the comments below. And remember, if you're experiencing any prostate symptoms, talk to your healthcare provider. Early action leads to better outcomes.